I'm really proud to be launching this tonight because it's truly been a labor of love. And it's been something that's been kind of bumping around in my head for actually a lot of years. And how I kind of got the idea was I was at an Allergan training, and there was a doctor from Brazil. His name was Dr. Braz, and he has some published studies on facial structure. And basically, if I identify a person's basic facial structure, that over time, you know what they're going to need. I can tell you what you're going to need in a year from now. I can tell you what you're going to need 5 years from now. I can tell you what you're going to need 10 years from now, because aging is unfortunately going to happen for all of us. But I should say fortunate, if you're fortunate enough to age, after some of the things that I've been through. But it happens for all of us, but it's actually a very methodical process. It may not feel methodical, but it actually is a very methodical process. And so if the people that are treating you can understand that, then we can kind of know where to start and prioritize things for you. Because I have a lot of patients, I've talked to a lot of patients through the years, and as I come sit in my chair, I hear the same thing over and over again. It's like, well, I went to this place and I went to that place, and they didn't even tell me about all the stuff that you've told me about, or they didn't even educate me about my face, or they just did what I wanted them to do, and they didn't really do anything else for me. And I thought, well, who should be in the driver's seat here? Because we're the ones who understand aging. Not that the patient's concerns don't matter, because they absolutely do. But ultimately, we're the ones who know what's going to be happening to your face and how to prioritize your care. And so that's how this methodology came about, is trying to figure out a way that we could deliver comprehensive, personalized, individualized care to our patients. And it's something that I've trained all of our providers in at Glow. So you don't have to just come see me to get this. You can see any of our providers. They've been trained in this methodology. The beauty of it is we can start it with somebody who's 20. We can do it for somebody who's 80. So it's not specific to any person's age either. We can start, and we can also use multiple modalities with it. So if dermal fillers are not your thing, fine. We can use laser modalities and microneedling like Rebecca was talking about. So it's perfectly customizable for what you are going to be needing. However, if you're not going to be doing some of the fillers and other things, we might be a little limited in your results. I'm just saying. So brace yourself for that. But the thing that I love is you will leave when you come in for this assessment with a beautiful pink folder, and it's going to have a 1-year plan in it. And we map out if you have vacations, if you have weddings, if you have reunions or events that you need to do, we can schedule this all around that for a whole year. I do this for a living, and I can never remember when I received my Botox until my neck falls. And I'm like, oh, my Botox must have worn off. And I think about how busy everybody is these days. And if I can't remember when I got my Botox, how can any of our patients remember either? Is it realistic for me to expect them to remember? So that's where in this we can map out what month you're going to be due. We can put it on the calendar. We send you home with this calendar. We send you home with information, all the products that we recommend, and that folder is yours to keep, and it is your roadmap. We will adjust and reassess along the way as we need to, but every year we can update your folder, give you a new one if it's all beat up, if it's been in your trunk of your car. Please don't leave it there. But from that standpoint, I've developed this because I want us to level up the care that we're providing to our patients. We don't want to just piecemeal things and treat just your lips or treat just your cheeks, because then what have we really done for you with regard to making you the freshest, most vibrant, youthful version of yourself and giving you ownership of your look and the aesthetic messages that your face is sending. So that's why we have this methodology. So tonight, anybody who books a Tectonic consultation for the rest of the year at Glow Medical with any of our providers, our thank you to you for being here tonight and for giving us a try and trying out this methodology, which we believe you're going to love. You will get a complimentary Skin Medica product just for booking that consultation with us by the end of this year. So thank you for your time and your attention tonight, and I hope you all take advantage of this new methodology.